Hey, welcome back. Happy New Year. We had to take a little month off because we had holidays and then we got some snow in Dallas, which gets everybody all crazy. But we're back here for episode 6. We've made a couple changes for the new year. You now have a leather-bound notebook.
I do.
So that you can refer to your notes.
Yeah.
Which we need because it's better to bring that in than the file we have.
Right.
Yay sick. I believe where we had left off, we were starting to talk about a new drug called Clozaril.
Correct.
Also known as clozapine. And we said, as we ominously ended the last episode, that's a whole nother topic. Well, here we are. And let's talk about Clozaril/clozapine.
So it all started, like you said, we ended it talking about this introducing this new drug.
Right.
But the reason was his hallucinations were increasing a lot.
To trifold.
A whole nother level.
Yes.
And we were noticing he had so much fear about everything.
Everything.
The big thing was he, wasn't just the big thing, but he would not.
Well, it was one of several big things.
He would not go upstairs by himself at all. He wouldn't leave our side. So every day, his room and Jackson's room, our room, was upstairs. So if he had to go upstairs for any reason, we had to go with him. We had to turn every light on upstairs. We had to show him that.
We had to go preset the area so he could.
We had to turn on all the lights. We had to open the doors. We had to make sure, in his view, there was nobody in there. And he wouldn't, like, if we went outside to get the mail or to walk out back with the dog or anything, he'd freak out because he'd seen a man back there, several different men back there or out front. And he was just so afraid that something was going to happen to one of us.
And he couldn't describe the man.
No.
It was like, it seemed like what he was saying, it was like more of a shadow.
Yeah, a shadow figure.
Yeah.
It wasn't until later, we'll get into that years down the line, where he could actually describe the men. But at this point, a lot of times it was just the man, the figure. And every sound he would question. I mean, if an airplane went over, he'd say, "What was that?" But then other times, like I think you and I were talking about, we'd be watching football or we'd have the TV on and there'd be noise, just regular noise.
There'd be ambient noise going on and he would go, "What was that?"
Right.
And we literally didn't hear anything.
Didn't hear anything.
It's different than if you do hear a plane going over and you say, "Oh, that's just a plane." But literally we would not know what to say.
Right.
Like I didn't hear anything.
Or he'd say, "Who whistled?" And we were like, there's no whistle, Kason. And like that, it's just it just was happening more and more and more. Then we started noticing he would say, "What did you say?" Like I would be in the kitchen cooking dinner and he'd be in the TV room and he'd be like, "Mommy, what'd you say?" And I was like, "I didn't say anything, bud." And he's like, "You called my name." I was like, "No, I didn't call your name." So again, just like in the past, we kept notes. I would write down, he heard this, he said this, he saw this.
And of course, these symptoms are making us think about some words that we're sure hoping aren't going to be true. That ended up, we're going to get there. So,
right.
Yeah.
The other big thing that just one day started happening, he would not eat his favorite foods. So I would give him mac and cheese.
Which already wasn't a huge list.
Right. Extremely picky. He's extremely picky. I'd give him some mac and cheese and he'd just sit and stare at it. And he'd kind of move it around. And I'm like, "What are you doing?" And he's like, "I can't eat this." And I was like, "Why?" And he'd just look at me with this weird look and he'd say, "You put something in it." He's like, "I didn't put anything. It's just mac and cheese, same stuff you've had for the last how many years." And he would push it away and he's like, "It tastes funny. I'm not going to eat it." So all that together, we go back to Dr. T and she increases his Zyprexa, which is one of the antipsychotics he was on.
Mm-hmm.
He was at a pretty decent dose of that. He was still on the lithium. He was on other medicines too, but all these hallucinations with the amount of antipsychotic he was on. And he was about 9 and a half.
9 years old.
Yeah. She'd mentioned Clozaril to us. And And I'll get into that in a second. But she was trying to hold off on this med.
Yeah, she had mentioned that it was kind of the last thing she'd want to try.
Right.
She wanted to try all the newer medicines, and
right.
because there was some concerns with that drug, with Clozaril.
Right. So she increases the Zyprexa. And then we had another incident where one morning you, of course, weren't home.
Yes, because I was with my mother, who was getting one of her various appendages replaced.
I think it was her knee.
Was it her knee?
Mm-hmm.
Yes, it was her knee. Yeah, it was her knee. So the one day that I have to go with my mother to the hospital is the day that Kaysen has an incident in the hallway, eventually in the bathroom.
Okay, so you leave at like 4 a.m.
Yeah.
You have to
sure.
Go get your mom, get her to the hospital. And so I have to get both boys ready. And at this time, Kaysen and Jackson went to 2 different schools in North Dallas. One was on one side, the other was on the other side. And so I'm getting them up, and I'm like, okay, we got to hurry. And of course, as you know, Kaysen doesn't hurry. Everything's a battle. Getting their breakfasts, getting all his medicines out, all that kind of stuff. And it gets to the point where I'm like, okay, you need to go, we need to go upstairs, Kaysen. You need to, brush your teeth. We need to do these things. And of course he's terrified to go upstairs. So,
and it's morning. It's daylight. There's,
Right. And Jackson was up there. So I was like, surely if I take him up there, knowing Jackson's up there, lights are already on, it's already, sunny's out, it's not going to be that big of a deal. So I take him up there and I show him everything's fine. And I said, look, Jackson's right there. Do this, and this. I give him his morning tasks. And I was like, I have to run downstairs. I have to finish making y'all's lunches. And I'll come right back up. Well,
what's the worst that could happen?
Right. And I literally run down the stairs. And 2 seconds later, I hear the loudest scream and a door slam.
Yeah.
And I'm like, what in the world is that? And I go running upstairs, and Kaysen's in the bathroom, and he's shut the door, and he's screaming, there's a man. He's going to get me. He's right there. And I'm like, Kaysen, look, it's mommy.
He's saying he was in the room right next to
the playroom, right next to him.
The playroom that was next to the.
Yeah. And I said, hey, bud, it's mommy. I'm right outside the door. I'm looking in the playroom. There's nobody there. And he's screaming. He's terrified. He was like, help me.
So you're negotiating with him.
I'm negotiating.
Which is something we typically had.
Yeah, he hadn't locked the door, but every time I tried to open it, he was using all his strength. And when he would get like this, back to when he attacked us and stuff, his strength was control.
He's 9 now, yeah. not.
And he could hold that door.
Yeah.
And I didn't want to hurt him, pushing the door open. And it took me probably 10 minutes or so to finally get him to be like, look, I'm out here. I'm walking around. There is nobody up here. It's okay. I said, can you let me in, open the door? And he eventually let me peek my head in to show him it was me. It wasn't anybody else. And he's looking at me. And
So you're saying he literally thought there was a possibility as you were talking to him that you weren't you?
I have no idea. He was just so terrified.
Yeah.
And of course, Jackson, poor little guy, is just looking at me like, what is going on?
Now, was he in the bathroom?
No, he was in his room.
Okay.
Which, was right across the hall from there.
Okay.
And so I told Jackson, I'm like, hey, it's all good. I said, why don't you go downstairs? Because we were trying to separate Jackson. I said, why don't you go downstairs with the dogs and try tying your shoes and, finish putting your lunch in your bag, and I'll be down in just a minute. And so I finally go and get Kaysen to let me in the bathroom, and he's just freaking out. And I happened to look down, and I was like, uh-oh.
Yeah, and this is the weird part to me. This is very telling of what was going on. You go in, as far as you know, he's just slammed the door, right? And you go in, he's bleeding from his hand.
And I look, and he's not looking at it or anything. I just noticed there's blood, and I was like, oh my gosh. And I said, let me see your hand. And I looked. Well, he had obviously slammed his pinky in the door when he slammed it, and his finger was flat like a piece of paper flat. And I was just like, this isn't good and this isn't normal. And why is he not screaming about his finger?
And that's the thing, is that, as we know, if Kaysen scratches his finger, even now, he is concerned he's going to bleed to death. And the fact that happened, and that would have been, I would think, pretty traumatic for him, that he was basically unaware of it. I mean, that's pretty crazy.
Yeah, that shows you where he was mentally. And so I take his hand and I'm looking at it, and my first thought is, this is an ER visit. But
we're not doing that.
Yeah. I said, because of what had just happened, 6 months to 9 months earlier. I was like, I am not, with the way he was with his hallucinations, I am not taking him to an ER, because I know what's going to happen. He's going to be labeled the psych patient. We're going to end up not getting the finger fixed. We're going to end up trying to get admitted into psych. And I'm like, I'm not doing that. So I tried to act super calm and was like, Kaysen, your fingers hurt. And once he kind of noticed that there's something not right, he was like, oh yeah, my finger. But he still wasn't freaking out the way he normally would. Mm-hmm. So I'm like, hey, let's get in the car. I said, we got to take Jackson to school. And I said, but I'm going to call his pediatrician, and he likes her. So, I said her name, and he was like, okay, she'll fix it. And I said, yeah, she's going to fix it, knowing there's a 99.9% chance she's going to look at it and be like, why are you here, kind of thing. So
why are you here and not the emergency room?
And so we get in the car. I call them and said, Kaysen's...
You've already called me, too.
Yeah, I called you. And of course, you can't do anything.
My mom's not out of surgery, so I can't.
You can't do anything. So called the pediatrician, and they were like, yes, bring him in. We'll take a look at it. Drop Jackson off. Got right into the pediatrician, and the nurse comes in, and she's like, what are you here for? And I said, well, he smashed his finger. And she looks at it, and she just kind of gives me this look like, why are you here? And she goes, but let me go get the doctor. And so she comes in and she takes one look at it, and she's like, yeah.
And it was pretty serious, because he had broken the finger basically from that second knuckle up, and the fingernail had literally popped off.
I mean, it was like I said, it's flat.
Yeah.
Your finger's not supposed to be flat.
Yeah.
And she knows about Kaysen's history. She's been very supportive of him and us. And she was like, we can't fix this.
Right.
So I'm kind of talking in code with her, and I'm like, I can't take him back to the ER. What do you suggest? And she was like, well, you know what? I know a guy. He's a really, really good finger hand surgeon. He's down in Dallas. Let me call him and see if he can squeeze y'all in. And I was like, okay, great. So she goes, calls him, comes back, and she's like, can you be there at 10? And I'm like, yep, we can be there. Now, she was like, he's not a pediatric doctor. This is not a pediatric orthopedic anything. This is not a children's hospital. This is all adult. And I was like, okay, this could be interesting. So I called Mom, and I said, you're coming with me to this doctor. And I told her what had happened. And so on the way down there, picked up my mom, and we go, and Kaysen's starting to amp up more. It's almost like part of that shock and part of that psychosis.
He's now talking about his finger.
A little, yeah, he's now.
Well, and that's also because people have been looking at it.
And stuff.
They've drawn attention.
And I really can't tell you how he wasn't screaming in pain. Because he never said, oh my gosh, it hurts, it hurts, it hurts. I mean, not until later, but even the hand surgeon was like, how is he not? And I was like, well, he's got some issues going on. So we get there, and I have to start explaining to the nurses. I have to start explaining to everybody the situation, how this happened. This is why Kaysen's acting this way. The looks I get, again, are like, he's 9 or almost 10. What do you mean he hallucinated? And, why is he on this med? And, I have to take a deep breath and just be like, they have no idea what they're talking about. So I'm not going to get mad. I'm not going to judge them. Just let's deal with it. So they get us in a room, and the surgeon comes in, and of course he's an adult doctor. He does not deal with kids.
Right.
And he's doing this kind of as a favor. And he's like, hey, Kaysen. And Kaysen wants nothing to do with them. And he was like, we need to go get x-rays. And of course, Kaysen's like, I'm not going to do that. It didn't take long for this doctor. He was an excellent doctor, zero bedside manner. And then you add in Kaysen, he struggled dealing with Kaysen. And he didn't have the patience for Kaysen and what it took to get an x-ray, several x-rays of his finger. And finally got that done. And then he said, while they were waiting to get the result, or not but for him to read the x-ray or whatever, he was like, okay, I need you to sit here, Kaysen. I need to clean this out. Well, that did not go over well with Kaysen. And so my mom and I are sitting up over here and we're bribing Kaysen with every...
Same things we had to do with blood tests.
I mean,
we're going to buy you a Lego. We're going to get ice cream.
Yeah. Let's just have him clean it. And then we'll get this. And it took so long for him to clean it and really look at it and just see, you could see the destruction on the inside. And then he gets the x-ray and he takes one look at it and he says, he needs surgery tomorrow. And I was like, oh, this is not part of the plan. I really thought you could just put a splint on it and we could go on our way.
Well, they put a splint on it.
Well, they did, yeah. So he's like, come back, different hospital in the morning. Again, not a children's hospital. They don't usually deal with children. Come back in the morning. This is at surgery time. Can't eat, can't drink, no meds. And I was like calling you and saying, okay, so he's already hallucinating.
He's already hallucinating, which means that the medications he's on are not doing enough. And now we have to stop taking them.
Right. At least for
a day.
At least a day. Yeah.
Which is normal. People who get surgery can't take any of their medications for the anesthesia.
Right. Well, at this point, Kaysen was taking meds 3 and 4 times a day.
Yeah.
And so in our mind, we were like, okay, so he won't take his morning dose and he won't take his lunchtime dose. We're like, okay, those 2 doses, maybe it won't be that bad. So of course, Kaysen's terrified. And so getting him the next morning, getting him dressed, telling him he can't eat, he can't drink, all that kind of stuff.
Totally breaking from the pattern.
Does not go over well with him. So it's a huge battle. Of course, Jackson, we had to get him to school, and try to act like life is normal for Jackson. Like, it's no big deal that your brother's having surgery and then he smashed his finger yesterday because a man was going to get him, and, just trying to make life normal for him. And we get down to the hospital and we start the journey of, what medicine is he on?
With the anesthesiologist. Yeah.
Why is he on that? Who is your psychiatrist?
Yeah.
Why are you allowing her to give you this? He's too young. Do you know how dangerous this medicine is? Do you know how dangerous that medicine is? Why did he smash his finger? What, were you not watching him? Why did he do that? Well, he was hallucinating. He wasn't hallucinating. He's too young. Well, no.
This is an anesthesiologist saying this.
And nurses that were there. And so we're having to explain. And Kaysen's very amped up and nervous and doesn't want to be there. And they finally ended up giving him, through a mask, some like laughing gas kind of stuff to calm him, because again, they needed to do an IV and all that kind of stuff. And there's no way he was going to let them do that.
Yeah.
And they asked, would he be aggressive? Can he be aggressive? And we're like, absolutely. And so they're like, okay, here's the laughing gas stuff. So they did that with him. And at this point, Kaysen had been sedated, not with the Xanax and stuff like we've talked about in the past. He'd been sedated for MRIs. He's had several MRIs, but he had never been under general anesthesia before. So we didn't know how he would react, especially with the medicines. And of course, the anesthesiologist is telling us he's on a lot of medicines for his age. So he goes off to surgery. I think it was like an hour and a half long. He ends up doing fine. They call us into recovery, and we take a look at his arm. Again, this was his pinky finger.
Right. Yeah.
And we go in there, and he has the biggest cast on his whole arm.
He had his shoulder replaced.
Yeah, and this massive thing on his hand.
Yeah.
And you and I both take one look at that and said, A, he's not going to tolerate that.
He's not going to put up with
B, that is a weapon. He's going to hurt us with that. He's going to hurt himself with that because it was hard. It was big. And
it was designed to protect the finger.
This finger, because they ended up having to reset and fix this bone and kind of do something weird with his nail bed. It was kind of gross. But so Kaysen starts waking up and instantly starts throwing up. Like, instantly throws up.
And we probably, at this point, at this juncture, we probably should have assumed that if there's going to be complications from anesthesia, it's going to happen because it's Kaysen.
Right.
But we didn't. And so we were, again, shocked that he was incredibly nauseous and vomitous for hours
and hours. And that was they gave him Zofran. They kept giving him the other anti-nausea stuff. They would try to get him to sip on apple juice or anything, and he would just throw it right back at them.
So much for the catching up on the doses at the end of the day.
Right.
He wasn't going to hold him down.
No. So we ended up having to stay at the hospital longer because they didn't want to release him when he was so sick.
Right.
And so we thought finally he was kind of over that hump until we get him in the car. And thankfully my mom was in the car with me and you were driving your own car. And thankfully they sent us home with all these special barf bags, because he threw up for several more hours after we get home. And, of course, then they're like, next time he has anesthesia, you need to let them know that he's extremely sensitive to the anesthesia. Maybe it's his meds, maybe it's a combination, but you need to make sure that they know. And now that he's home, he cannot take any meds. And we're like, okay.
Yeah.
So he was going to be without med. They said 24 hours. Thankfully, the anesthesia made Kaysen very tired and groggy. So we weren't really battling behavior issues at that point. We were just battling he would not stop throwing up.
Right.
It wasn't until later that night did he understand and discover that his hand is completely
immobilized,
and that he can't take it off and can't get it wet and he can't move his hand. He can't do anything. Did that start becoming a problem? And he had to keep that on for, I think it was like 2 weeks or so.
Honestly, I have blocked a lot of that out of my mind because
it was a horrible experience.
It was bad. It was bad.
He hated it. It also, his finger hurt. They wouldn't give him pain medicine, which is fine, but a lot of that was because of his other medicine. And because of certain medicines, he can only take Tylenol. He can't take any Advil or anything like that. And so we were giving him the Tylenol and stuff, but then the behaviors ramped up because he didn't have his meds. And so we felt like, once again, we're kind of having to restart, even though we weren't restarting his meds, to get them back built up in his system. So it just kind of felt like every time we felt like we were kind of getting on track, something like this would happen and kind of shoot the wheels off. So probably a month after that, we go back to see Dr. T.
And she has acknowledged that this, as she said, well, I want to try these other protocols. I don't want to do this medication until it's a last resort. But she admitted that the door incident was the last straw. We had to try it.
Do something. And we waited a month from when he had the surgery because we needed to get back on track with his meds.
Right.
And so we go in for that appointment. And like I said, she'd kind of talked to us a little bit about Clozaril, but this appointment, she talked a lot about it. And I'll give you a little history.
Well, it made us really excited about getting on it.
Right. Yeah. Yeah.
Yeah.
She, so she explains that Clozaril,
let's go a little aside here. Clozaril was introduced in 1970.
Right. 1970.
Had a tremendous track record with mental health patients. Led to the clearing out of a lot of mental hospitals.
Yes.
However, they found a few years later that it was leading to side effects. Like if you got a cold, you might die.
Right.
So the FDA took it off the market.
Banned it.
Until 1989.
So she's telling me that this med, Clozaril, in 1970, was used mainly as a last resort to treatment-resistant schizophrenia. So that was the first time...
So we're hearing the word.
Schizophrenia.
Yeah.
That she... not that she hadn't used that word before, but when you talk about Clozaril, you talk about schizophrenia.
Right.
And so it was used for mainly treatment-resistant. Like you said, had great results until people realized, doctors and stuff were realizing people are dying from a cold, and this isn't good. So,
and why was that?
Because it drops your white count.
Right.
And unknowingly, it was dropping people's white count, and they were getting sick, or they would get an infection and dying. So, like you said, it was banned. And from 1975 to 1989, those people with schizophrenia really, really, really were struggling. Psych hospitals were filling back up a lot, and the FDA finally was like, okay, we've got to reintroduce it. But with very strict protocols.
Right.
So this is probably why I have my notes, because I can't remember the whole thing, what it's called. But so part of the strict regulation is that, well, let me back up a little. Most psychiatrists to this day do not prescribe Clozaril. They don't want to mess with it. If you are a psychiatrist, you have to apply and get certified to prescribe it.
So you can't just prescribe it.
No.
You have to be authorized to prescribe
it.
Yeah.
And same goes for pharmacists and pharmacies.
They can't just dispense it.
No.
They have to be approved to dispense it.
Right. And they have to be approved to be part of, it's called the REMS system, which stands for the Risk Evaluation and Mitigation Strategy Program. And so the FDA set this up to help protect patients
who are taking
the medicine. So what that entails...
Patients whose psychiatrists were willing to take the risks and get approved to prescribe it to pharmacies, which there weren't a lot, and we'll get into that in a second, who were willing to go through the protocol to dispense it.
Yeah. Correct.
So everyone's got a whole lot of work to do here to CYA for how we're doing this.
Right. So she tells us this is kind of the gold standard medicine. I really think she talked to her...
The gold standard.
Yeah, the gold standard for schizophrenia.
Right.
Not just for mood disorder. But
it's just very dangerous.
It can be dangerous. And she had talked to several of mentors and stuff about Kaysen, and they are prescribers of Clozaril as well, and they agreed that this is kind of the next step. And so the protocol was, you have to get, for a long time, like a year, maybe 2, I can't even remember. He's been on it for 13 years now, so I don't remember, but you have to do weekly blood draws.
And we've already talked about how blood draws went.
Right.
So now we have to tell them, hey, we just have to get one of these every week.
Every week. And you get the blood draw. The results would go to the doctor.
And this is just to measure white blood count.
They would measure, they get a CBC of your blood, but they would check specifically white count. If it was in range, she would mark it, check it, circle it, whatever. And then she would, back then, 13 years ago, she would fax it to the pharmacy.
Right.
And the pharmacist would look at it and make sure, okay, yes, his white count's fine, and would dispense 7 days of pills only. No more
pills. No refills.
No refills.
It's 7 days. Yeah.
So 13 years ago, our doctor had told us it's you've got to find a pharmacy that dispenses it, that is in the registry. I'm like, okay, not realizing how hard this is going to be.
And there's drugstores on every corner.
Right.
They're like Starbucks.
Right. So I start calling our normal pharmacy, and they're like, no, we're not authorized to dispense. I'm like, okay.
And they weren't going.
And they weren't going to.
Right.
I called so many around, and finally I get online and I do a search, and the first closest pharmacy was in South Dallas.
Yeah. The other end of town.
From where we are to go down there weekly for 7 days worth of medicine, I was like, this is ridiculous. But if that's what we had to do, that's what we had to do. It wasn't until like a couple days later, while we're figuring all this out and Casey's getting his first blood draw and everything, I happened to call one more pharmacy that was close to us. And they happened to be like, you know what? We actually just got approved like a couple weeks ago.
For the one other patient.
Patient we have that's on this medicine. And I was so relieved. I was like, oh my gosh, it's going to save us so much time. They were new to this REMS program, but they were on board with it. And that became our new pharmacy for quite a while. But that's kind of started that journey of Clozaril. So he was on the Zyprexa, high dose of that. And as we've talked before with these meds, you don't just stop cold turkey.
You have to ramp it down and ramp up the next one.
So we were in the process of doing that. And I specifically remember it was spring break. And as usual, we weren't doing anything. Both boys were home, and you would take off that week of work just to kind of help me be home with them. But we couldn't travel the way Kaysen was. We couldn't do any of that.
It was a great time.
Yeah. But we had heated the pool, thinking, okay,
maybe some swimming.
Maybe we'll do something. I mean, at least with Jackson. But in this process of lowering one and increasing the other, Kaysen became like, he wasn't violent, which is good, but he was so in his own world. It was weird to watch that he could not relate to you at all. And he had this blue stuffed animal, this dog. He still has it, still on his bed every day, named what?
Blue Pup.
Blue Pup.
Yeah.
But he was attached to this, and these dogs used to talk to him. That was kind of another thing. But Blue Pup would have a conversation with him and stuff. But Blue Pup, he literally would sit on the floor and flip Blue Pup up in the air over and over and just watch him and laugh. Watch him and laugh. And I'd be like, you try to get into his world and be like, Kaysen, you want to come swim? You want to? And he just kind of look at you. Blue Pup.
He wouldn't say yes or no. He would just go back to what he was doing.
I mean, it felt like it.
Because he was just in another world, and he wasn't really reacting to anything or talking to anybody. He barely acknowledged anything.
Mm-hmm.
And I other than a few bits of, I would even say in the few fits of mania that he's had, that was kind of an isolated incident where he was like that. He definitely behaved in a way that he had never and really hasn't since as a result of that transition.
That transition. And he was like that for kind of that whole week and a half.
And I think one of the things that you think about, and I'm sure anyone who's going through the cocktail, medication cocktail journey can relate to this. We dealt with side effects, that weren't supposed to happen, and they were happening. So when you see your child acting like this, how are you sure that this isn't going to be some sort of permanent effects? You don't know until it stops.
Right.
And that was something else that we were not really talking about, but it was on our minds, just like when we'd have a dystonic reaction to something else, we'd panic. Panic wasn't the right word for this, but it was definitely concern.
Yeah, very concerned.
Is this the new case?
Right. And of course, we were in contact with his doctor, and he's still having to go get his weekly labs, and she thought
even she was saying, well, let's just give the medicine time. It wasn't like she was like, oh, that's normal.
Yeah, she was just like, he's just
taking some time.
Yeah, he's just reacting to coming off one and starting the other one, and got to see it through like we always do. And he came out of it, and we successfully weaned completely off the Zyprexa and got on a higher dose of Clozaril.
Well, we had an introductory dose of
slowly kept going up. Over the next several months, we had, I think it was one or two actually, where his white count came back too low, and you have to stop the medicine.
Right.
Which was concerning because we were literally like getting so defeated because we were like, we just started it and we were seeing, it was helping. His hallucinations were decreasing, but you have to stop it and you have to repeat labs until your blood count goes up. And that happened like 2 or 3 weeks in a row.
Which means sometimes you were having blood tests every day.
Right. And it was just very hard. And we came to find out his psychiatrist actually reached out to another doctor and was asking about Kaysen's blood count and stuff. And they suggested, don't get his blood work done in the morning. Let's move it to the afternoon, because in some weird, rare cases, people sometimes their white counts lower in the morning.
There was just not a way to be very comfortable with it all. We knew he needed it, but we also knew about the warnings. And then when someone's like, oh, do this, it just all felt really weird.
It is weird. Well, and we didn't mention that you look at the side effects, like Google side effects of Clozaril, and
those.
It's all heart related. It's like myocarditis and cardiomyopathy and heart arrhythmias.
One other thing I will say about the trickiness of Clozaril when you're taking it every week, when you have a prescription for a allergy pill or something you take regularly, if for whatever reason the pharmacy runs out of stock or you call in your prescription too late, they'll give you 2 days worth of pills while they're waiting to connect with your doctor, because they know you take it and you're supposed to take. They can't do that with Clozaril.
No.
So it wasn't like we had to come up with a schedule where, if the prescription, we picked it up on a Monday and it was going to last us through Sunday, we couldn't wait till Friday to do the blood test. We had to do the blood test like Wednesday.
Right. Because you have to have time to get results, and then it faxed over. And
then, of course, because the pharmacy was new to the REMS, not everyone knew about it. The pharmacist you talked to
didn't. They had no idea.
Texts were like, oh, it's not here. We don't have your blood test. No, it's there. Oh, yeah.
So then I have to call her office.
I hear it's on my phone. Well, we can't take it on you're going to have a printed
copy.
You have to print it. It was just, it was a lot of work to do. And it was a long year because we couldn't, for a whole year, we had to do it every week. When it moved to every 2 weeks, it just felt like, oh my gosh, this is so much better. And now it's once a month, which is we're so used to it now, but that's very manageable. But of course, there's side effects. So one of the things that we talked about, kind of referencing in this episode, being about new drugs and new doctors. Up until this point, we've been seeing our psychiatrist regularly. We had been going to, we talked about we were going to OT twice a week.
Mm-hmm.
We were, of course, getting blood tests. So we had a fair amount of appointments. Pediatrician once every 6 months, or, he was sick or something. But we were already managing a fair amount of appointments. Well, it didn't take too long for the side effects of, and the potential side effects of this drug to create, let's just call it an expanded medical team.
And not all of it, come to find out, was just side effects. It becomes who Kaysen is.
Right.
But
that's another story. But yes.
Another story. But
yes, at this point, we're like, okay, we're going to make sure that we're accounting for the potential risks of Clozaril and the things that it can do. So
right.
Let's talk about our new doctors.
So we start adding our list. So we go back to a new neurologist because he still has the movements. Yeah, he's still doing his tics and stuff. But we also were concerned he was having absent seizures because there were several times in school had noticed it too. Sometimes he would just.
Well, it was like that week over spring break.
Yeah.
It was much shorter incidents, but
he just kind of.
They were telling us that he seemed to go off into his own world for a minute, a couple minutes, and then he'd be fine.
Right. And seizures are a side effect of Clozaril.
Of course they are.
I go to the neurologist, and she does an EEG, and then that was a little abnormal, wasn't for sure. So we ended up doing having the company come out to the house and hooking him up, and he did like a 72-hour one where, again, this is casein where you're not supposed to.
That's where he had to wear the
at home,
the spider web thing on his head. It had all the, oh my gosh, and he couldn't shower for 3 days.
He couldn't do his bumping and crashing. He couldn't get mad. I mean, it was.
And looking back on it, I almost can't believe that he was able to do it.
Yeah, I don't know how we pulled that off, but a lot of bribes.
Yeah,
which was
bribes are a big
thing. But thankfully, he did not end up having seizures. But the neurologist became a every 6-month kind of deal to monitor him. Mm-hmm. The big one that we ended up going to see was an endocrinologist, because at Kaysen's physical that year, I think he's about 11 or so, she notifies me that his private parts aren't developed to where they need to be. Mm-hmm. And of course, I'm not checking his private parts.
Oh, yeah, sure. And you don't have any of your own, so I mean, you don't.
Right. Well,
I noticed though. I mean, I remember saying, I don't know that he is maturing the way he should be.
Yeah, and at this point, Kaysen is still wetting the bed every night, wearing
pull up.
Depends.
Don't call it a diaper.
Yeah, depends. Because he'd outgrown the pull-ups. But
right, true.
So the endocrinologist kind of wanted to see about some of that too. He'd gained a significant amount of weight because antipsychotics caused that. And also thyroid, because lithium affects his thyroid. So we go see her. And that starts more blood work. Every one of these doctors requires their own panels and blood work and what they're looking for.
And this introduces another kind of complication, because obviously if you have a problem with your lungs and you go to a pulmonologist and they're going to ask you about your lifestyle and things you're doing, and they're going to tell you not to do things because of your lungs. Well, now we're starting to talk to everybody about, hey,
different parts of his body.
Different parts of his body, and he shouldn't really be taking this medication, and he should just get off that. Right. Everyone's kind of watching their own turf, and we're getting all these conflicting things as we talk more about these doctors that introduce this sort of, okay, we're going to have to refer you back to our psychiatrist who will explain to you why these things are necessary. Yes, we understand the risks. Yes, we know what the medicine does. No, we're not bad parents. All those things started happening.
Right.
The endocrinologist was the first one.
She was actually pretty good about it. I mean, she was like, wow, that's a lot.
Yeah,
she was like, that's a lot in the lithium and stuff.
It was really more about the cardiologist, the liver doctor we had to add, where I'm not saying that a heart's not an important organ, but they're
concerned about their
specialty.
Right. So during that year, Kaysen started getting infections, weird infections like skin and
pneumonia.
He got pneumonia out of the blue, like not even being sick. Like he came in to our room early one morning and was coughing, and he's like, I don't feel good. I'm like, but it was pneumonia.
And it was
summertime. He had repeated sinus infections, so he was on a lot of antibiotics. And so pediatrician referred us to an immunologist. Well, the immunologist does his whole workup and was like, well, there's like 3 immune markers, and Kaysen's are all low normal.
All of them.
All 3 of them.
Yeah.
And I think it's okay, but I think this is why he's repeatedly getting sick. But as long as he is able to stay out of the hospital, especially with pneumonia, then I think it's okay. I don't want to do anything because he's on all this medicine, but we're going to watch him.
Again, that's very reassuring. I think it's okay.
Yeah. But again, that became like an every 4-month visit with him. Then you mentioned the liver doctor, who is gastroenterologist, but his specialty was liver. And we started seeing him because Kaysen's liver enzymes went through the roof. That became pretty regular. I want to say that one was every 2 months. More blood work. He would have constant ultrasounds of his liver.
Yep.
He ended up with mild scarring on his liver.
From taking
medicines. So there was that. Then we finally convinced Kaysen to go to see an eye doctor. We knew his vision was off, but
this was what we had noticed was, Kaysen loved watching movies or whatever, but he was just getting closer and closer to the TV, to the point where he was like right next to the TV, and we were asking him, can you see it? And he would just say, well, I just see better from up here. Interesting that he was aware enough,
right,
to know that he did not want to go to the doctor, because he did not want to wear glasses.
Would not even.
He was going to be very self-conscious about wearing glasses. So
we finally convinced him.
We finally convinced him to go.
Get a bribe.
He thought it was going to hurt to go to the eye doctor, which, I remember thinking, come on, it's not going to hurt. Well, they do that little air blowing thing where they check. That was going to bother him, but I didn't talk about it. We got him there, and we went through the vision test, and to say he was legally blind was a bit of an understatement. He was 2,400.
That was more than that.
No, it started there. It's gotten worse, but it started at, this is about as bad as it gets. And, we were talking about, glasses are expensive, and we're already paying so much money for so many things. Luckily we just, this was about the time that you were starting to see like Warby Parkers and Zennies and stuff start to come out. We knew we were going to be buying new glasses every 6 months.
Because he's going to break them.
Either he's going to break them or his vision is just going to get worse,
Well, we were more concerned because when he gets mad, he would take them off and throw them and stuff. And we're like, we're not going to spend $800 on a pair of glasses that he's going to smash. And
so we were buying economic glasses that
plastic things that
would last,
But remarkably, once he put them on, he didn't like the feeling at first, but when he first put them on, he couldn't believe that there were leaves on a tree. He was so blind.
Couldn't believe there were leaves on a tree.
He hadn't seen much of anything, which is weird that.
I remember he said, so that's what leaves look like.
Yeah.
I thought, wow.
That is weird. But it was interesting because when he was hallucinating, which he was still hallucinating because we weren't on the highness dose, it just wasn't happening every single day. He would started to be able to describe it a little bit more. And I think it's because he could visualize more. I don't know if it's because he could see better. It was just kind of weird. So that was another, we had to go every 6 months because his vision, they wanted to check it. And of course, every 6 months we went, it got worse and worse and worse, which is so weird. And then the last one was the cardiologist. Because of all the medication in the Clozaril, we needed to go see a cardiologist. And we go, and she does the echo and the EKG. And sure enough, he has something called long QT.
Long QT.
Which is, I would guess you can describe it as like a heart arrhythmia, in the sense that on the back end of a heartbeat or something, it's like prolonged.
Right.
And if it gets too prolonged, then it can cause not good things.
Distress.
Yeah, with your heart. And
so now this is something else we have to monitor. We still monitor it to this day. Something else we have to monitor with regularity.
Right.
As we measure medications.
And she was very, out of all these doctors, she was the most adamant. He does not need to be on these medications.
Get him off these medications.
Yeah, she was the most adamant. And she was just like, he's too young. Do you realize what these can do? And I had to just keep telling her, I understand. This is the first time she'd met Kaysen, and he's sitting there. He's not at that moment hallucinating. Right. He's not as crazy as he was 3 years prior, where he would literally go and just bang his head against a wall repeatedly. You know, she's seen Kaysen sitting there nervous because he doesn't want to have an EKG done or whatever. And she'd be like, he doesn't need that. And I said, do you realize the only reason he's sitting here like he is because of these medicines? And she was very, she just kept reiterating to me, you know, you need to understand how important the heart is and things like that. So
we kept saying, yeah, we understand how important the heart is.
Right.
We know.
We needed to have, I think it was every 3-month EKGs. And we did a couple of those heart monitor Holter things that, you know, overnight, or they would have it for 48 hours and track it when he would do any kind of physical exercise. And anytime he felt chest pain, he had to let us know. He had to let the school know. He had to stop his activity. But this cardiologist is friends with his endocrinologist. And at one of his endocrinologist appointments, I happened to mention that interaction and how I was kind of frustrated. And she ended up saying, I'll talk to her. And once she talked to her more about Kaysen and what's going on, she got on board. Like, she understood, okay, wait, these aren't crazy parents that are just trying to do whatever to their child. Right. Like, they understand the situation. He still sees that same cardiologist, get on this regimen. We're weekly blood draws. We're seeing psychiatrists. We're seeing all these doctors. I mean, talking about me living my life in a doctor's office, I did and continue to do, you know, how many years later. Yeah. It's time for his 3+ year neuropsych eval.
Yeah, which I felt like we did every year.
Which he has to do for school. The same doctor that did it, his original one at 4.5, where she was like, this is going to be bipolar. So go see her. It's a all-day process with breaks in between. And so I had filled her in on how the last 3.5 years, 4 years had gone, and the hospitalizations and all that kind of stuff. And she's like, oh gosh, it's been a journey.
It's been rough, yeah.
So they're almost done with the testing for the afternoon, and she comes out and she's like, can I talk to you for a second? And I'm like, yeah, this is never a good sign.
Never good.
And her assistant was finishing up with Kaysen, and she, you know, pulls me into her office and she said, are you aware that he's having hallucinations, auditory hallucinations? And I was like, yeah. And she's like, well, because this whole test, he's been answering the voices. And I was like, really? I mean, I know he does that, but to that extreme. And she was giving me examples, and she's like, well, yeah, like we'd ask him a question on a test, and which is more educational and that kind of stuff. And he would say no, but when he would say it, he wouldn't look at the examiner. He would look over and he'd be like, no. And they'd be like, Kaysen, you know, and go try to redirect him back. And then he would be out of the blue, I'm Kaysen. And they were like,
so interestingly, these hallucinations did not appear to be scaring him.
No, but he was having, she said he was actually engaging and having conversations with these voices.
Yeah.
And she takes note of all of that. And she was like, so I just want to make sure you're aware of it. And she goes, I know you'd mentioned hallucination stuff, but she goes, but to see it in action like that over that whole day, she was like, it was pretty interesting. She goes, so give me about a week and a half. I'm going to put, you know, go through everything and put it together. And then I want you to come in and meet. So come back in about 2 weeks or so. And she says, okay, here's the report. She's going through everything. And she said, so he definitely has schizophrenia.
Ooh.
And
we've been thinking about that for years. Certainly hoping it's not going to happen, hoping that the hallucinations are just, I don't know, manifestation of the medication, or, you know, it's going to pass or whatever. But now we're getting an official diagnosis of schizophrenia.
And she said, because he's bipolar, because I asked, so does that mean he didn't have bipolar? And she's like, oh, no.
Because she's the one who told us that he had bipolar.
Right.
Right?
She says, no.
Oh, no.
So he technically has, it's called schizoaffective disorder, which means he has both. He has bipolar, which is the mood disorder, and he has schizophrenia, which is the psychotic side of things.
And when you told me this, I had heard of schizophrenia. I had heard of bipolar disorder. I had never heard of schizoaffective disorder, which is effectively both.
Right.
Now, the first thing that I thought, it's already been a pretty isolating experience having a child like Kaysen, just because of his, he's not growing up like normal kids. So anyone we were spending time with when they were 4, now that he's 12, he doesn't act like he's 12.
No.
But now that you start to throw words around like that, I became a whole lot, it all hit me really hard because, this was after the time we were having regular school shootings and police chases and stuff like that. And there was always this tendency by the people who were reporting it on the news to say, by the time you got to the second or third update, they were like, but there could be a history of mental illness. And it was almost like it was intended to reassure me as a viewer that, don't worry, this person was crazy. So that's why this is an isolated incident. And by the time we would get to the end of the story, it was always a big part of the story that they would find out that he had schizophrenia or that she had bipolar disorder.
Or the voices told them to do it.
Or the voices told them to do things. So, yes, I'm, as another person, as if you were, I'm reassured because this was a crazy person and I don't know any crazy people. But now, more than ever, the word schizophrenia, the word bipolar disorder, these are polarizing, scary words. And when you hear someone has that, you're going to be afraid of them.
Mm-hmm.
And it's not that we didn't have fears of Kaysen, certainly well-founded within the incidents that were happening in our household. But now it was just very aware to me that this new label was, what was this going to mean moving forward? Because it probably wasn't going to be good.
Mm-mm.
It wasn't like it's going to improve anything for him.
No, it was going to make his quality of life worse. It was going to make our quality of life worse. And at that moment, ironically, the first thing I thought of was, don't you remember when we told the social worker when we were going through the adoption process, the reason we chose not to have any mental illness?
Anything but mental illness, yeah.
Because the range of it from mild anxiety to schizophrenia, and now we have both?
Now we have both.
That seems like a cruel joke, kind of. In my mind, I was like, this is a lot.
It was a lot. It was a lot to take in.
And even though we kind of, I think deep down knew that was coming, that diagnosis was coming, and we were already on the Clozaril, which is a drug for schizophrenia, to see it in a report, to have a neuropsychologist who knows all about this tell you that it's just kind of a gut punch. But that wasn't the end of the report. One of the most surprising parts of the report was that she said, Kaysen's IQ has dropped significantly.
Yeah. He
is now almost to the point where he would be intellectually disabled.
I mean, one of our favorite movies is Forrest Gump, and of course love Forrest Gump, love Forrest. But they described his IQ as being around 75, which from the movie, that's what Forrest's IQ was when he was like 8 or whatever he was. So Kaysen's 12, and he has the IQ. He has an IQ of 75, and that's dropped significantly.
Yeah, because remember when he started off all this, he was in the above average.
Yeah.
But she showed me all the testing, and he was barely reading at that point. He still struggled mightily with the dyslexia and dysgraphia, but she noted that comparing all his different neuropsych tests, she was like, it's pretty clear to me that there was some brain issue around age 6, she said, that there's, I don't remember if it's the left or the right side, whatever, I don't remember, but she said there's just some kind of stoppage of development almost is how she described it.
And that was, I consider that a diagnosis, but it's we don't know what to call it. We just were basically told, hey, sometime around the age of 6, it appears a part of his brain, a significant part of his brain, just stopped developing.
Kind of just stopped developing. And she said, this is kind of what we're seeing now, that he's...
And she also said, that is unrelated to the schizophrenia and stuff. That seems to be an additional issue.
There's something else going on with that. Because you can have severe mental illness, but be extremely smart,
sure,
and function and have jobs and go to school. She made it very clear at this point, this is not going to be Kaysen. And she didn't know at this point how much more Kaysen was going to develop or not. So that was almost worse than getting a schizophrenia diagnosis, because kind of up to this point, we still kind of had hope, even though he was way behind educationally. We kind of didn't, I don't think, understand that he was going to be on an intellectually disabled diagnosis or path,
right,
and what that meant for him and what that meant for us.
Yeah.
So,
I mean, it wasn't like we were harboring dreams of, he was going to go to Harvard and be a doctor or something, but we had not yet considered that his quality of life, his ability to live independently, was fully in peril.
Right.
And now that was, and at the time, hearing all of those things was confusing and confounding, and it wouldn't be for another couple years until we realized, in some ways, those things were blessings and a discovery as to why probably these things had all happened. But that's...
Right. So at the end of that appointment, I was again heartbroken, leaving there all like, are you kidding me? But she said, I highly suggest you get genetic testing done on him. She goes, the fact that he's adopted, and you don't have all the answers, but she's like, looking at Kaysen's list and looking at his severity of mental illness, and he's got the autism, and he's got the learning, and he's now intellectually on the verge of being intellectually disabled. She's like, I think it would be worth your time and effort to go see a geneticist. So she gives me a name of a very well-known geneticist here in Dallas, and she's like, I think he's gonna really help you. And that's the next
chapters. We'll talk about that genetic testing. We'll pick it up there next time. I'm Jeff.
I'm Kim.
And this is Specialness. See you next time.